Hey guys, I'm back. I got my cat now. Say hi to the camera. Okay, most pets, especially at the beginning when they start to get the shot, are definitely not patient and they don't want you to do it. My cat, sometimes she's not behaved. Most of the time she's okay, but towards the end of the shot she'll start getting angry, she'll start meowing, hissing, groaning, sometimes biting me if she feels angry. But most of the time, now it's been probably around 4 years that I've been doing this, that she kind of starts to purr and she knows that this is the schedule. Cats love scheduling. So if you do it at the same time every day, probably it's going to be better for you and the cat, so that you don't have to struggle with the cat or dog, I guess, every time. Okay, so in the last video you noticed I taught you how to put together the infusion set, the IV, for the cat. So now I'm going to teach you how to actually do the subcutaneous injection. Now please note, I am not a vet, I'm not a doctor, I'm not licensed. Okay, so talk to a vet first. Don't just take my word for it. Although most vets just go by the book, you know, I'm not a vet, so you need to decide who you believe. All right, anyway, this is how I do it, so you can choose to do how you wish. Depends on your vet, of course. So what I'm going to first do is get a cotton ball. I've got a container here with alcohol and cotton in it, stainless steel. And again, you want to wash your hands before you do this. You want to grab the cat's fat here in the back. You'll notice that there's, you know, many places that you can pull along there depending on your cat or dog and how fat they are, or how much, I don't know what you want to call that, loose skin, I guess. Okay, well, you want to grab somewhere along there that you can actually, you know, get something in your hand. And then take the cotton ball, and the first thing I like to do is kind of move the hair out of the way so that I can actually see what I'm doing. All right, and what you're looking for is kind of like a little hole, a little bit of indentation in that fat, in that skin. Okay, and I like to make sure that the whole area is nice and clean to avoid bacteria getting into the cat. It looks like there's one right there. Unfortunately, it looks like a place from last time, so we're going to move over just a little bit to avoid injuring the same tissue as last time. Okay, I'm going to squeeze a little bit of alcohol in there. Alright, it looks like that's the right place. Alright, so that's done. Alright, so what I'm going to do, and I just dropped the cotton ball on the floor, so I'm going to prepare another one for later. Alright, now I've already released water into the wing needle here. Just put a little bit out on there to make sure that there's water in there. Lock it. And now what we're going to do is you're going to find the little nipples on the needle so that the needle's in the right direction. I use my teeth. Okay, so the needle is open. And then we're going to slowly make sure that it's straight and insert the needle into the cat. Okay, now she's a little bit angry. It probably hurt. I'm going to take this and stick it there for now. Move over the three-way to the position so that the IV can start going into the needle. And usually I use my leg first. And I start gently pushing because the alcohol, there might be some alcohol on the needle when you push in. And so the cat or dog may feel uncomfortable. And I start slowly for about 10 milliliter. And then I just start pushing a little bit harder. And this, you can time it if you want about how long it will take me, and then because my hands are big enough, I'll just put the rest of it like this. And it doesn't take very long. You don't have to be overly slow, and it also depends on how big your needle is. Mine is 19 3/4, so it's a little bit bigger, and that's also a little bit more painful for the cat, I think, but my cat is not so patient most of the time, so I want to use the slightly bigger needle. Okay, so that's 60 cc already, or 60 milliliter. I'm going to refill it, as we need to give our cat 120 milliliter per time. Now, some people will say don't give any more than 100 at one injection site. I've been doing this for 4 years. I do 120, sometimes 130, and there's never been an issue. But again, check with your vet before you do that. Okay, again, I'm going to use my leg because my hands are not that big, but big enough, around 40 to 50 milliliter after we do about 10 to 20. So that's about 40. So I switch now to use my hands to make it a little bit faster. I'm not a professional speaker, guys, so sometimes I lose my train of thought, as you've probably noticed in the video. But I try my best. And the reason why I'm doing this video is that I've searched YouTube, and there's only like one video I found that somebody's doing the injection by gravity. My cat would not tolerate that, as it takes too long. All right, so that's it, guys. I finished 120 cc. I get that cotton ball. I put the cotton ball just at the end of the needle, and make sure you pull the needle out straight. Okay, and then you want to hold that for a few minutes to make sure that it's not bleeding as you put the needle back into the sleeve so you don't poke yourself or other people. All right, and then I have a hook. I have a hook on the wall here, and I just hang up the syringe in that for the next 3 days. Now, I know that the syringe should only be used once, but I don't know anybody who uses it once, throws it away, and then uses a new one, because the IV bag at 120 cc per day can last for 4 days, as the IV bag is 500 milliliters. Now, if you're in the US, 500 milliliters, I have no idea. You'll figure it out. Anyway, I think they're all the same size. They're about 500 milliliters, and you can use it 4 times, sorry. So that's basically it. Again, once your pet gets used to doing this, usually they're a little bit more calm. My cat's still purring, actually. She started purring when I put her here. Through the whole process, she's still purring. That doesn't happen all the time, but it happens more and more often now that she's more used to doing this process. And I do it roughly the same time every day, so she gets used to that already. Okay, so let me just give a check here to make sure that it's not bleeding, which it is. It is bleeding. So I need to actually find the site. And there it is right there. And I'm going to put the cotton ball back on it and hold it for a few more minutes as I talk to you. Kidney failure doesn't have to be fatal. If you take care of your pet well and you give them the subcutaneous injection every day as recommended by the vets, and you make sure that your pet is getting enough water every day, it doesn't have to be the end of life. Of course, it could be, depending on how serious the problem is. But we've been doing this now for about, like I said, about 4 years. We have noticed changes. Her creatine levels are going up a little bit. BUN and phosphorus are quite stable depending on the type of food that we give her. But the one thing that you really need to understand about kidney failure is that dry food really is the worst for any animal. At least as the main diet. Now we also use a dry food called KD I think it's from Hills, but it's a supplement only. Some canned food doesn't provide all the nutrition, and that our cats are used to eating dry food, so they always demand it. But most of the time we're giving them wet food. This is just as a supplement at night. Dry food is bad, it's dehydrated, it doesn't provide any liquids. And cats especially, they need the liquid, as you've probably done your own research already. So wet food is important, water is important, and the subcutaneous injection, depending on what your vet recommends, is very important for your pet, especially for cats. Let me check that again and make sure that it's, yeah, okay, it's basically okay now. Now, usually when I stop the process is when she starts getting angry. I use some clean toilet paper, tissue, whatever you want to call it, to dry the alcohol a little bit so that she doesn't lick that alcohol afterwards. But this is the point where she usually starts getting upset. She starts getting angry at me. She wants to come down. She'll get angry, groan, hiss, stuff like that. And there it goes. And then she just hissed at me. Okay, this is quite normal. But at least during the process of injection, usually she's quite calm, which is the most important part of the whole thing. Now, you may not have a table like me. This table is actually from IKEA, and it becomes quite large actually, but it can fold up quite small just like this, which is excellent to give them the shot because they don't have anywhere to go. They need to stay in this little small place, and they're not walking around and stuff like that. And if they do move, that you can easily control it. And sometimes at the very beginning you will need 2 people, 1 on each side of the table, to hold the cat down. But because we've been doing it so long, we know basically what she's going to do every time. Yeah, I know. I'm almost finished. Give me a minute. And that's basically it, guys. If you have any questions at all, you can feel free to write comment below, and I'll try to answer your question the best that I can. But again, ask your vet. They're not going to give you every answer, but they're a start, and you can ask me whatever you need in the comments below. Anyway, take care, guys. Thanks for watching. Have a good one.